Okay, what'd you do, bud?
I think I have a slight sprain.
Okay.
It hurts when I get into like the front rack position.
Okay.
It's getting better.
Is it on the dorsal surface of the wrist or volar surface of the wrist?
Ulnar surface.
Okay.
I feel it like right here and through my palm.
Okay.
Yeah.
So that's called the thenar eminence. There's 3 muscles in there, right where you're pointing to your thumb. So let's take a look. Let's use a chair while this dries off. I'll sit in one, you can sit in one. How old are you?
32.
Okay. How long has this been happening?
About 2 weeks.
Okay. So in this position, open your thumb, open up your hand as big as you can. Don't let me move your thumb. Pain there? Okay. Lift your thumb straight up toward the ceiling. Don't let me push your thumb down. Trouble there? Okay. Go like that with your thumb. Don't let me open your thumb. Pain there at all? Okay. Keep your thumb here. Don't let me move it. So all the contractile tissues are fine in your hand and even in your forearm, which is fantastic. So let me just look and see if any trouble there?
A little bit of like pain.
Where? Okay, just on contact. Okay. And how about here?
Still fine.
Okay, we flip you over. Anything in your carpals at all?
No, that feels fine.
Okay, good. So lastly, put a thumb inside your fist and then very, very slowly, very gently bring your fist down. Does that kill you?
Right here.
Okay, is that the symptom that you feel? No.
No.
Okay, so if we come up into that rack position, we start getting you up here. Any trouble?
Way better than it was yesterday.
Okay.
Good.
Is it moving into the palm of your hand at all?
I'm feeling it right here.
Okay.
Starting to feel it right there.
Okay. So come on up. I just want to make sure it's not your median nerve because when you're up here, you got a lot of tension on your median nerve. Let's get you up on your back. As long as it's not your median nerve, we'll treat it locally, but I just want to rule out the idea that it could be a nerve entrapment. That's the big, the bad, and the ugly, and we're hoping that it's not the big, the bad, and the ugly, right? Okay.
Yeah, I hope it was just a mild sprain.
Yeah, and you're probably right, but
It's only in that one position.
stay super duper relaxed. We're going to depress here. Let me know if this lights up your palm or your thumb, or if it stays just in your elbow and forearm.
Mostly feeling my shoulder.
Okay.
I feel the tension. Okay, there we go.
That's what I'm talking about. Is that in your hand?
Yeah.
It's in your hand?
Yeah.
Okay. And that's where you feel it?
That's where I feel it.
Okay. So that has nothing to do with your hand. That's all your median nerve.
Oh shoot.
Okay. No, it's okay. It's nerves don't stretch. Okay. If you stretch a nerve, you're in big trouble. But they have to move like dental floss. So you and I can't stretch our floss. We got to slide it between our teeth. Your median nerve has to slide out of the neural foramen from your neck at the nerve root level. Has to slide and glide all the way down.
Yes.
And yeah, exactly. And if it doesn't slide and glide and you're putting it way down here under the load of a heavy bar and you don't have enough excursion around this tissue, the thoracic outlet, your elbow, your wrist, etc., it's going to give you a zinger. And that's what's happening. So here's what we're going to do. I'm going to basically just gently take your nerve through range. I'm not going to stretch your nerve because they don't stretch, but I'm going to floss it. And then I'm going to teach you how to do it. So stay super relaxed. Don't let me take you up to the ow, 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 ow. Just let me take you up to the threshold, right about there.
I'm feeling a stretch in my bicep right now.
Okay. That into the hand yet?
There it is.
Okay. So it's not until you get to very end range.
Yeah, so like I said, something like the front rack position. Where
So let's make certain.
yeah,
Take.
feeling it.
Okay. So let's bring your head way over here. And what that does is it's going to slacken the nerve roots in your neck. Now is that much?
Feeling it.
Okay.
Yeah, right there.
In your hand.
Yeah.
Okay, now, very gently, let's take your head off the opposite direction. There you go. Real easy. Let the arm go.
Right there.
Okay.
Yeah, still feeling it.
Okay. So, did you see how it was much worse when your head was over there? That's how we know for certain this is a neural issue, okay? Because when you take your head opposite, you're pre-tensioning all those nerve roots. So This is a problem that's just going to have to be managed, okay? And it's easy to manage. I'm going to loosen up your pec minor and the thoracic outlet. Stay as relaxed as you can. I'm going to do a first rib depression to give you a little bit more room for that nerve. I'll stretch out your trap and your levator on this side, and then I'll do a cervical manipulation, mobilization for you to open up a little space for the nerve roots a little. Okay, and then I'm going to teach you how to slide and glide that nerve so that before you take the bar, you don't have as much tension on it.
Okay.
What are you shooting for today?
I'm just hoping to make great attempts, so I'm like not very competitive.
Okay.
I'm too
Well, you're
small.
here, of course you're competitive.
But hoping to snap 56, up to 56, and clean up to 72.
A lot. So how would I've never done CrossFit, but I take care of a ton of CrossFit athletes in my office.
Yeah.
If I weigh 185 pounds, and I can take 185 from the floor, and I can clean and jerk it and press it over my head. Would I be at all competitive at a meet like this, at that weight, or would I have to be like way up over 200 pounds?
185 is about
Here, I'll tell you, kilos.
that's like 85 kilos.
I don't know, I have to divide by 2.2.
It's about 85.
185 divided by 2.2. Yeah, right on.
85 is like top of the weight class, like top weight of the weight class. If you practice it, you could probably get up to 100, and you'd be competitive at this meeting like that. Yeah. Probably what you're going to see some of the guys in this next session here. It's going to be an 85 class, and you're probably going to do about 100 clean and jerk.
Wow. So that's the heaviest weight class there is?
No, there's 85, 95, 105, 105 plus.
The big boys.
So Andre, who you are helping out, so I'm at a disadvantage because I'm so tall.
Right.
And I don't weigh a lot. I'm in the 77 class.
Okay.
Andre's a 105 plus, and
Yeah, he's a big dude.
yeah, that's what I have to be any hope of being competitive.
Got it.
I'm just here for fun, for my own
That's good, man. That's awesome.
competing against myself or
Good.
gravity.
That's the most important competition to always have, is the one with yourself. It's how you expand and grow and get better. Doing okay with that?
Yeah.
Is it only when you have a lot of load on the bar, or is it just that position by itself, even with the bar?
That position by itself.
Okay.
Sometimes after I warm up a little bit, it gets better, but yeah, I thought it was a sprain, but I guess it's just the nerve.
It's a little neural tension, yeah?
Yeah.
Doing okay?
Yeah.
Okay.
I've had chiropractic work done.
Okay, cool. So come on up to sitting. Let me show you how to do this by yourself and actually get that nerve to slide and glide a little bit, okay? I want you to think of like a waiter in a restaurant carrying a tray, okay? Well, what you're gonna do is you're gonna turn the tray this way, and you're gonna have your elbow out to your side, just like so, okay? Almost like I had you on the table, okay? Remember, you can take the slack up in the nerve by moving your head, or you can take the slack up in the nerve by moving your arm, or both. So what I'd like you to do is to depress your shoulder girdle. So take your shoulder, drop it down, there you go. And then start to extend your elbow and point your fingers right down at the floor. And let me know when you start to feel that real nasty tension. Can you get all the way out without feeling it?
Yeah. I feel the stretch in my fingers, but not that thing in my
Okay,
palm.
so now gently, 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 take some more tension up in the nerve. Feel that running all the way down?
Yes.
Okay, so now you can either slacken it here, or you can slacken it with your head. You use whatever works best for you. It doesn't matter, okay? It doesn't matter if you take the slack up here or with your head, but what I want you to do is I want you to sensitize that tension all the way through your palm into your fingers. You're gonna feel it come on, and then you're gonna take it off. You're gonna feel it come on, and then take it off. And that way, when you get the bar up and it's sitting back here on you, you don't feel that tension.
I think I know what causes this too.
What happened?
When I do a snatch,
Yeah.
I have a tendency to work my head to the right a little bit.
That's exactly what did it.
That's good.
Yeah, totally. Try it. Try loading yourself with the bar and see if you can throw it up there.
Okay, I need to warm up first. But
Yeah, no, it's fine. Even just with a bar, or just try this with your hand. Is it hot? Okay. Bend your head over to this side. That take it away.
Still hot.
Okay. How about if you retract your shoulder girdle a little bit?
Still feel it in the palm.
Okay. It's just in the palm?
Like the palm and like this tissue right here.
Okay. So let's go do a local treatment.
Yeah, I'm actually gonna
Here. Here, have a seat there. We'll do a little localized.
makes it harder to.
Whoop, too much. Look at that. There you go. You ever had biofreeze put on you before? It's just going to make it cold. There shouldn't be any local pain or tenderness in here based on your exam finding. Is that killing you?
It's not killing me. It's just like, hey, don't do that.
Okay.
When they have the bar.
You guys, I'm not even sure what they're called, but I've noticed people lifting this morning, they have what look like little white coped things in their palms wrapped to their wrists. Are there some of the ladies that are allowed to like use something to help them hold onto the bar?
I think you're allowed to use gloves.
Okay.
You're allowed to use straps.
So you can't use something that actually grabs the bar for you.
No, you have to use your actual grip. The lube might be a lube that goes in the wrist wrap. Most people don't gloves. Like, they'll have stuff taped just to like put lots of stress on the skin.
The little field shoes, they look like they're real stiff and hard.
Yeah.
Is that just so that you don't fall backward when you throw the bar over your head doing a snatch?
They give you stable flat neck. Yeah.
Ready?
Oh, I knew it.
All right.
See?
It gives you a stable.
It angles your foot down, so it gives you it's easier to get into a low squat position that way. It just gives you like the slightly lift ratio has just a better biomechanics with this. And the shoes are very stable, so like it does make it harder to fall over backwards.
Just gives you a really good, solid, stable platform for a squat. Could you do a regular back squat in those and feel comfortable?
Oh, all the time.
So you wouldn't want to go running in them?
Oh, no, you don't.
Just for lifting.
Just for lifting. Like,
Yeah.
Like, people aren't going to, I'm not going to wear them outside of the gym at all. Okay. Do you think this is still related to the nerve issue?
Yeah, I do. But it can be entrapped anywhere from here all the way to here.
Yeah, it could be.
It could be at the elbow, it could be in your thoracic outlet, it could be in your cervical spine, it could be in your forearm musculature, it could be at the carpal tunnel, because it's the only nerve that goes underneath the flexor retinaculum at the wrist, and that's why I'm treating you in multiple places. I just wanted to do the best you can for you. If you've got to go warm up, go. Get out of here.
Yeah,
I'm here all day.
All right, thank you.
Yeah.